Welcome to the Pain and Inflammation video series. I'm Terry Shockley, Vice President of Sales for Anabolic Laboratories. We've been providing quality nutritional products to doctors for over 85 years. I hope you find these videos helpful, and we look forward to doing business with you. I'm once again joined by Dr. David Seaman and Dr. Russ Antico. Gentlemen, thanks for being here.
Good to be here.
Our topic today is chronic pain and inflammation, using botanicals, the primary ingredients found in Anabolic's all-natural product, Pro-Enz. Dr. Seaman, let's start with you. Can you summarize how these botanicals in Pro-Enz actually work?
Sure. Turmeric, ginger, boswellia, and the other botanicals, they have an ability to influence diverse aspects of the inflammatory process. They can influence prostaglandins, leukotrienes, cytokines, and they can inhibit an important signaling molecule called the nuclear factor. And the important aspect of this is that long-term dysregulation of the inflammatory mediators leads to chronic disease and disability of aging.
So modulating pain, again, is key.
Oh, absolutely.
What types of patients benefit the most from a product like Pro-Enz?
Well, any patient who wants to pursue long-term health throughout their lifetime, prevent chronic disease, and particularly from a more symptom perspective, to reduce aches and pains in the musculoskeletal system. Even the gastrointestinal system can be calmed down by botanicals. Are
there any contraindications to a product like Pro-Enz?
Absolutely none. Consider from the perspective of these are the botanicals used at ethnic restaurants, like Indian restaurants, and no one's told not to go there. The one situation might be allergies, which is occasional, and I would never give botanicals to a patient already taking blood thinners. Okay. Other than that, you're pretty clear.
All right, so pretty safe.
Oh, yeah.
Dr. Antico, if you recall in our first video, we talked about pain and treating it with salazane. Second video, we covered acute injury recovery and the use of Xymane.
Sure.
I think what the audience would want to know is, where would a product like Pro-Enz fit?
There's three different ways I actually use Pro-Enz within my office. The first situation would be in a subacute situation where the patient may be 2 or 3 weeks into care. At that point, they're wrapping up on the acute protocol with the Xymane, the omega-3, and the salazane for pain. At that point, what I like to do is introduce the Pro-Enz. The proteolytic enzymes used long-term will continue to go ahead and regulate inflammation so as to not let it get out of control and again lead to a long-term healing response. Secondly, I use it with patients with chronic conditions, arthralgia, cartilage degeneration like you could find in a knee. Those folks do real well, again, with something that's going to go ahead and control inflammation on a long-term basis. You certainly have to recommend a healthy diet. You have to recommend that those patients watch their activities, but using the Pro-Enz along with the fish oil offers a very safe alternative to controlling inflammation. And then lastly, you have folks that are healthy, don't have any conditions, but may exercise very intensely several days a week. We all know that that type of exercise is going to lead to inflammation, and over time that inflammation can actually accumulate and lead to tissue breakdown and pain. So if you have a patient who is taking the Pro-Enz on a regular basis, again, it's going to help just to control that inflammation, keep it from spiking, and subsequently that patient experiencing any discomfort. And I use all three of those ways on a regular basis throughout my office.
That's a pretty broad spectrum of patients you're treating with Pro-Enz.
It is. It's a great product.
Like we've done in the previous videos, can you think of one case study in particular that kind of stands out as a highlight in terms of patient outcomes?
Yeah, I can. I have a patient I've been treating for quite a while, just about 10 years now, and he's got some chronic knee issues, some osteoarthritis in his knee. Up until about 3 or 4 years ago, he was treating it, with prescription medications, anti-inflammatories, pain relievers, things like that, and he was really looking for another alternative. So I put him on the Pro-Enz, the fish oil, and the salazane for pain control, and he's done real well with it. Now again, this is a guy, he's in good shape, he's not overweight, he watches his activity level, but he's more or less been able to get rid of the prescription drugs and really doesn't have to reach for anything but the salazane for when he does have some discomfort, and he's been real pleased.
Okay. I have to ask once again, why Pro-Enz?
Pro-Enz has really proven itself with regards to results. Anabolic has proven itself time and time again with regards to producing a quality supplement. And at this point, after being with Anabolic and using their supplements for such a long time, the confidence level is very high. I need something to supplement my manual treatments with my patients on a regular basis, and Anabolic has really done that very well for me.
Dr. Seaman, Dr. Antico, once again, I just want to thank you guys for your thoughts today on treating chronic pain and inflammation with Pro-Enz. If you would like to learn more about Pro-Enz and to read additional case studies, please visit us at www.proenz.com. For any questions you may have, please call our technical experts at the number on your screen.